Hello, good afternoon, and thank you for joining us on today's Facebook Live event sponsored by our partners at Myriad Genetics. My name is Shelby Monier, Vice President of Patient Programs and Education here at Zero. And today we are thrilled to have Rob Finch here with us talking about genetic testing and prostate cancer. And Rob, you're going to help us lead this really awesome discussion. So thanks for being here.
Sure, great. Happy to be here.
We are thrilled to have you. Rob is a certified genetic counselor. He's also the director of Urology Medical Affairs at Myriad Genetics. And Rob really just works to educate and provide clinical support to healthcare providers who treat prostate cancer for Myriad's MyRisk hereditary cancer test and Polaris. So we're thrilled to have everyone here with us. Rob, we're thrilled that you're joining us today, and thanks so much to Myriad's partnership. And we're really looking forward to chatting about genetic testing today and its overall role in personalized medicine and personalized care from really the diagnosis through treatment.
Yeah, absolutely.
So let's just start with a little bit of general Q&A. We talk about prostate cancer really all day, every day, I think. But let's just talk about really how common prostate cancer is in the United States.
Yeah, it's actually a lot more common than one would think. It's the second most common cancer among men in America. 1 in 8 men will be diagnosed with prostate cancer in their lifetimes. So it's more common than you think. That the only cancer that's more common in men is lung cancer.
Yeah. Thanks for that. I think the statistics are pretty staggering, and when, like we said, we talk about them all the time, but when people hear them who aren't overly familiar, I think we tend to shock a lot of people. Well, we talk a lot about screening, and there has been a little bit of controversy on when screening should test. Are we over screening? Are we over treating, over diagnosing? But in general, I would love for you to share just about a little bit about when screening should begin.
Yeah, so most physicians will start screening gentlemen for prostate cancer about the age of 45 with both a PSA, so the prostate specific antigen test, as well as what we call a DRE, which is the digital rectal exam. Again, that usually starts at the age of 45 unless there are some other features for that individual that may make them at a little bit higher risk. So family history of prostate cancer, the known presence of a germline mutation in the family, things like that, things that would make us want to look a little bit closer, maybe a little bit younger.
Right. And it's not just the males, right? It's not just the male family members we need to be thinking about when you mention family history.
Correct. Yeah. So when we're thinking about hereditary cancer, and we'll get into this a little bit more, but we're looking for family members who have breast cancer and ovarian cancer and pancreatic cancer or colon cancer. And so things that we may not, as general population, think of as being related to prostate cancer. It's all important that our physician knows what other cancers are in the family history.
Right. So that hereditary prostate cancer, what's the percentage breakdown of the number of people, or the percentage of people who have what's thought to be hereditary prostate cancer?
Sure. So we've really only been keeping track of prostate cancer genetics for about the last 3 or 4, maybe 5 years. So there's been some studies that have looked at different groupings of men, but what we know is that up to about 17% of men, so up to about 1 in 6 men with prostate cancer will have a germline mutation that caused that cancer.
Okay. So let's just quickly define, it's confusing. Genetic versus genomic, somatic versus germline. Would you give us a quick overview of that so we can just make sure everybody's on the same page?
Sure. So whenever we talk about germline mutations, we in the medical community are thinking germ cell, which is basically the egg or the sperm. And so when we're talking about germline mutations, those are the ones that we inherit from our parents, both mom and dad. They're also the ones we pass on to our offspring. So those are the germline mutations. Now, cancer itself is a genetic disease. It's caused by the collection of genetic errors, but not just the ones that we inherit. They can just be in the cancer itself, and that's what we call somatic. So genetic alterations that are just found in the tumor are called somatic, and they're also important, but it different tests for those.
Right. Okay. So you said the word test. So let's just jump
Hmm.
right into really the genetic testing, what this personalized medicine can mean for patients. So we mentioned the stats, the staggering number of men diagnosed, and also who will likely be diagnosed in the future. So when and who should be considering these tests?
Yeah, so every man with prostate cancer should be considering whether or not genetic testing is appropriate for them. The coverage is very good as far as insurance is concerned for any man with prostate cancer. There are tests that are available that help determine, whether or not someone is eligible for a drug treatment, for instance. And because these have a lot of different implications across different categories, they're very, very well covered. And so every man with prostate cancer is potentially eligible for germline genetic testing.
Okay, so we talked, okay, so the people who have a diagnosis, but what about others? What can the genetic testing tell an individual about overall risk, maybe, of developing prostate cancer?
Certainly. So if you don't have a cancer diagnosis yourself, but you have a family history of cancer, the criteria is a little bit more. We're basically looking for, family members, either first or second degree relatives who have, early onset breast cancer. So, having a grandma with breast cancer at 96 is very different than having a grandmother who had breast cancer when she was 46. So breast cancer under the age of 50. And then rare cancers, ovarian cancer is pretty rare. Pancreatic cancer is pretty rare. So anytime we see those in a first or second degree relative, that's also an individual who might benefit from knowing whether they have a germline mutation that may increase their risk for developing cancer.
When you, as a certified genetic counselor, are talking about the benefits of genetic testing to an individual or to their family.
Yeah, so we're at increased risk for anything found in our family, but we just sort of have to guess. I have a family history of heart disease. Do I have heart disease? I don't know. So what we do is we go to our physicians and talk about our family history. Well, genetic testing for hereditary cancer can tell us exactly what that risk is. And so if we know we have a high risk for cancer, the studies show that we're more likely to get the screening that could potentially save our lives at a time appropriate. So we would get a younger, women would get mammograms at a younger age. Men would go talk to their doctors about prostate cancer earlier so that we can potentially detect those cancers earlier or prevent them.
Yeah, yeah, great point. And I think what you said about we just have to guess. So many families are left guessing because it's difficult. It's challenging to talk about your medical diagnosis or your health history. And we hear story after story after zero of families
Hmm.
who multiple family members have died. They didn't know really what was happening until after the fact. And this woman's story stuck with me. She lost four uncles, and it wasn't
Wow.
until the fourth that the family started talking about what all of these men in their lives had passed away from. Prostate cancer was never mentioned. And she and her cousins basically made a pact at the service to say we have to start having these conversations with one another, and it's up to us to start. So I love that point about having these conversations.
Yeah, I mean, we're getting better at talking about our health conditions, but some people are just ashamed of it, and it's
Mhm.
really nothing to be ashamed of. In fact, it can be used to empower other family members to prevent them from getting cancer.
Yeah, yeah, absolutely. Great point. Okay, so how do the tests like Myriad's My Risk Hereditary Cancer Test, Polaris, how do they differ from the really popular tests like 23andMe that we hear so much about and people are gifting one another at Christmas?
Right. I knew you were going to go there, but I as a genetic counselor, I put genetic tests into two different categories. The first is a medical grade genetic test, and the second is what I call recreational genetics. So medical grade genetics is we've been doing genetic testing for 35 years, so we know what we're doing, and our tests really help direct medical management. Whereas a recreational test is fun to talk about at a party, oh, I'm 87% Neanderthal. What are you? Or I'm, Irish. I have wet earwax, but those are all, really recreation. They're fun,
Right.
not to belittle them at all, but they're not something that you should use for, making medical decisions.
Yeah, yeah, absolutely. So you mentioned the decisions. You led me into my next question. So how can the results of these genetic tests, these non-recreational genetic tests, impact the treatment decision that someone diagnosed might make?
Certainly. So we know that men with certain genetic mutations are more likely to have an aggressive cancer. And so when someone is diagnosed with prostate cancer, the immediate decision is, am I safe to go on active surveillance, or do I need to have definitive treatment? And so if we know that that individual who's newly diagnosed has, for instance, a BRCA2 mutation, then we know that that cancer is more likely to be aggressive, and that we probably better treat it pretty aggressively as well, to make better outcomes.
Yeah, great point. We have come so far in the active surveillance space. So how much? First of all, the main questions that Zero receives around anything, but specifically genetic testing, is how much does it cost? And you talked about some insurance coverage, but since we get that question many times, I'm going to ask it again. If you can just highlight the cost and the insurance coverage piece once again.
Sure. So at Myriad, our primary goal is to get patients the information that could potentially save their lives. Our goal is to also get paid for it, but our goal is to get paid for it by insurance companies, not necessarily the patients. And so, these medical genetic tests are very well covered by insurance. So for instance, just throwing out Medicare, because most men with prostate cancer have Medicare, they actually pay for this test at 100%, no balance bill. And so they believe that this is important enough that all men with prostate cancer should have this information.
Yeah. No, that's great. And so what happens when somebody decides, okay, genetic testing is right for me, I've weighed the pros and the cons, I want to move forward. What's the process like? How is the testing done?
Sure. So they can go talk to their urologist, and the test is either done on a saliva sample or a blood sample, usually a blood sample if we can get a blood sample. And then it's sent to our laboratory, which is based in Salt Lake City. And then about 2 weeks later, the results will be forwarded back to the ordering healthcare provider, who will then call the patient in and discuss these results with the patient.
Does the patient ever receive the results themselves, or would that just be something that they could request
No,
from their doctor?
once the physician gets the result, then they can get the result from their physician. Also, once they get the result, let's say that they got the result a year ago and they've lost it, then they can call us and get that information. But really, our goal is to get this information into the hands of the physician, because then they can talk to the patient about it.
Okay, wonderful. Well, let's just talk right before we close out our Facebook Live event, just a little bit about clinical trials and treatment opportunities and advances for men with prostate cancer.
So very exciting in prostate cancer is that now prostate cancer patients who have certain of these germline mutations and also have developed metastasis are eligible for what we call PARP inhibitors. This is a class of drugs that was approved in ovarian cancer several years ago, breast cancer several years ago, more recently pancreatic cancer, and then most recently prostate cancer. And so if someone has metastatic disease and they have one of these mutations, they can go on these pretty exciting class of drugs called PARP inhibitors. And then there's always clinical trials looking for new ways of treating people. And so, new drugs, et cetera. And so it's always easy to get involved with a clinical trial if somebody is so inclined.
Yeah, that's great. We have a clinical trial finder on our website that pulls from clinicaltrials.gov, and really personalized and user-friendly. Has a really nice, pretty user face, which matters a lot, I think.
Yeah, of course.
Yeah. So we talk a lot about clinical trials. I'm so glad that you mentioned that. So where can patients find more information?
Sure. So we have a website. It's www.prolaris.com. Prolaris was one of the other tests that we talked about, but for men with prostate cancer, we just sort of lumped them on the same website. So it's www.prolaris.com.
Great. And I'll just make a quick plug for some Zero resources. We have recently added some website content to zerocancer.org. We actually separated genomics and biomarkers from genetic testing so that we could add a little bit more meat to those pages and clarify, like we talked about, the differences between germline and somatic, the differences between genetic and genomic, so that all of that information is more clear. We're also getting ready, and this is kind of hitting the news today. You're the first to hear it, kind of thing. We are almost finished with a newly diagnosed patient guide, and in that guide, we'll also have a good amount of genetic testing information. So we're really thrilled about that piece. It's going to be a really great comprehensive piece for especially for people who are newly diagnosed, but really for anyone, regardless of where they are in their journey.
Great.
So we're thrilled. Well, I don't have any more questions for you. I think I've sufficiently grilled you here and me peppering you with questions. But Rob, we so appreciate your time and your expertise and your insight.
Sure, no problem. I was happy to be here.
Great. Well, thank you. Have a great afternoon. And once again, I just want to thank Myriad Genetics for their amazing support and partnership over really all of our programs, patients and caregiver programs here at Zero. So thank you to Rob and thank you to Myriad. And with that, I hope everyone has a safe and cool evening and afternoon, and we will see you soon. Bye-bye.
Bye-bye.